Do you have a bunion and want to avoid surgery? Does your mother have a bunion and you don't want your feet to end up like hers? Make sure you check out this video. We see over 100 bunions a week and we successfully treat them so that you don't end up with feet like your mother or your grandmother or anyone else in your family you don't want their feet. My name is Daniel Fitzpatrick from Sydney Foot Solutions. We see lots and lots of bunions every week. In fact, well over 100 bunions a week through our clinic. And what I would say is that the big thing that we see is that most people don't realize you can effectively treat a bunion without being reliant on surgical intervention. In fact, surgical intervention is usually reserved for those extreme styles of cases. So make sure to watch this video. I'm going to give you a great option. I'm going to take you through one of our great reviews and great outcomes we've had with a recent patient named Sherry about her bunion. You can even check out the reviews at Sydney Foot Solutions Reviews. And so I'm going to read this out to you now. We're going to go through it. We're going to talk you through some options and try and give some really helpful tips that you can take away with this video so you avoid the need for surgical intervention for your bunion. So Sherry wrote, Daniel is very skilled at what he does. I was blown away at the improvement in my bunions during the treatment period. And the best part is my foot health will only get better with time. I'm now equipped with the right information to look after my feet long term. I'd recommend this for anyone struggling with bunions. Thank you, Sydney Foot Solutions team. And so what she's referring to is that we do a before and an after x-ray on people and we show the differences within people's bunions and the alignment within their feet. And so the reason we do that is that part of our assessment process, we do send for a weight-bearing x-ray if it's indicated after your initial assessment. And it's only if it's indicated. We don't send for that if it's not indicated. But what I would say is that we have a tried and true system for treating bunions without resorting to surgery. We have done this for over 20 years. In fact, we've had over 25,000 bunions through our clinic and clinics when we had two. This is not a new thing in any way, shape or form. And the great news is you can manage a bunion without being completely reliant on surgery. Because keep in mind, there's two main treatment options when you are considering a bunion treatment. So the one that everyone knows about is the surgical interventions. Just for the record, the surgeons do a great job. Most surgeons will try not to treat you if they can avoid it. They're very ethical that way, and they only treat with surgery if it is indicated. But be aware that with the surgery, there's a high level of cost involved in most situations. In fact, Google references it at anywhere between $5,000 and $8,000 for a bunion surgery. The time off work or time off your feet, is between 6 and 8 weeks. And it's usually about 12 months before the swelling stops. And don't get me wrong, if in significant cases like that, it is definitely indicated and the surgeons do a great job. The other option that you might like to consider is something like what we do through conservative management approach. We can actually start to straighten a bunion up. We can treat the pain, we can treat the underlying cause, and we can treat it quite effectively long term. And in most cases, we can avoid the need for surgical intervention. What we do is that we've got a special bunion assessment we do to people where we can give them a guide on what they consider, whether our treatment would be successful. If you're interested in that, go to info@sydneyfootsolutions.com.au and book on our bunion assessment. Just $40. It's over 60% off. At the moment, it's a special offer so people can get their bunion assessed and they can get some really great quality professional information. So you might say, how do you help me avoid bunion surgery? And the reality is that we do this all the time. In fact, we have about 100 ongoing bunion patients per week come through our clinic. And the way we do it is that you come in for an assessment. If it's indicated, we then send for further scans. And the process involves a gentle hands-on technique where we work on correcting that level of alignment and using exercises to support those changes. We use laser therapy to break up the pain and reduce the inflammatory response through the actual bunion area itself. And we get a great deal of success doing this. In fact, I have worked in this area for well over 20 years. And that's a sad reality for me that I'm that old. But what I would say is that if you do have a bunion, make sure you get it checked out sooner rather than later. The sooner we treat it, the higher the success rate, and also the higher the likelihood that you'll be able to avoid the need for surgical intervention and bunion surgery. If this sounds interesting to you, go to info@sydneyfootsolutions.com.au or click on the link below and claim our 60% off initial bunion assessment. The sooner you get it, the sooner you avoid surgery.